The story you are about to see has a happy ending. You are looking at her, baby Esther. But when the baby was still inside her mother, she was diagnosed with a rare tumor, a teratoma, which grew so large that it also endangered the life of her mother. The baby's parents could not afford private insurance, and her Medicaid doctors had never before seen such a tumor. In desperation, they called a children's specialty hospital in Philadelphia.
Well, I can tell you that much. Medicaid will not pay for this visit. So I said, maybe we can come on a self-pay basis first. Well, you can, but I must tell you that it'll be at least $10,000 for the visit. So, there wasn't $10,000. I didn't even have it saved up somewhere. So at that point, I was lost. I was really lost.
As RCCS provides an array of services for cancer-stricken patients in need, primarily the subsidizing of health insurance policies, baby Esther's mother decided to call RCCS.
Let me call RCCS. Let me give it a shot. And I must tell you that from that minute on, the entire perspective changed. Words can't possibly describe the difference in emotions where a financial burden is taken off.
If you do not have the appropriate insurance, you may be denied the optimal care. And if you're forced into an HMO, the providers in that HMO may not have enough expertise to be the difference between life and death.
With RCCS now covering her upgraded private health insurance, the hospital accepted her as a patient, and they soon prepared for the baby's delivery and subsequent surgery.
There was an entire team there. Pediatricians, cardiac specialists, resuscitation teams, and he had everyone standing outside of the room. The baby came just like any of my other children, and it was very obvious. It looked like a baby who had this huge tail. The tumor was hooked around the tailbone. She removed it completely, that she will not need radiation or chemo or any other oncological intervention. And Baruch Hashem, we have a healthy baby.
Rachel's story is not yet over. She still needs our support and our prayers. Almost 3 years ago, for seemingly no reason, she began experiencing unbearable back pain, not allowing her to stand or even sit.
I had the fine needle aspiration, and they told me right there that I had cancer, and that she said, I don't think that it spread, but she was wrong, because all the back pain for all those months was metastasized cancer. So I went to a doctor that this general practitioner had recommended I go see, and all I can remember, he said 18 to 24 months will try to keep you comfortable. That's it. Basically, my life was over. And I have a son who's now 11. Sorry. I have a son who is now 11, and I said, I'm not going to live for his bar mitzvah. How is that possible? So really, in one sense, my life really ended with those words.
If, unfortunately, you're diagnosed with a cancer, you need to have insurance so you can get the best treatment. It is vitally important that a patient diagnosed with a cancer reaches the best experts in the best institutions.
And one of the women in my neighborhood who had gone through this before said, you have to call Rofeh Cholim. And RCCS said to me, get the best insurance and don't worry about it, and we will take care of it. And they did, and they were wonderful, and they insisted. It wasn't even that I had to come and ask them. They never made me feel less than a mensch. Not having to worry about your insurance. It's huge. It's gigantic.
Until she was 2 years old, Miriam seemed like a healthy, ordinary child. Then everything changed. After a battery of tests, a tumor was discovered within her facial cavity. With RCCS help, Sloan Kettering Memorial Cancer Center accepted Miriam as a patient.
When Dr. Wexel walks into the room and he says, I'm going to write this down for you on a paper because it's a hard name to pronounce. Your daughter has rabiosarcoma. That is a minimum of a year of chemotherapy. Then afterwards we have to do surgery, radiation, all different other things. I've cried in my life, but this was the first time that I cried and I couldn't stop. And it just was pouring out. Originally, they told us the surgery would be around 18 hours. Best case scenario, they said, that she'll never be able to see out of that hour. That's the best case. Worst case, the face would be sunken in. They had to open the top of her skull and push up the tumor from the inside of the mouth. Once you touch the brain and you go near the skull, the recovery alone takes months to recover. Me and my wife were sitting in the room where you wait, and after like 4 hours, the doctor calls us and says, we don't know, we don't understand, but we grabbed the hold of the tumor and it just came right out. A half hour after the surgery, we were able to hold our daughter. She has her sight, she could play, she could run, she could do anything that any other child could do. And we saw this miracle that happened to us. On a daily basis, we received bills from Memorial, 50,000, 100,000, all the different bills that were coming in. I would estimate that Blue Cross Blue Shield paid $1.5 million.
In my experience with RCCS, a number of patients, both old and young, who have been diagnosed with cancer have been able to get their care from the best experts in the best facilities because the lack of insurance was not a barrier.
There is no other organization in the world that does what RCCS does. RCCS comes and says, you get the best doctors, you get the best medication, you get the best hospitals, and RCCS will pay the health insurance premiums.
It's not just Bikul Cholim, it's not just giving comfort. It's saving lives. It's saving families. It's keeping families together.
When RCCS came into the picture, it changed the entire outlook. It gave us the tools to deal with our problem.
RCCS really does give the money. They really help.
RCCS, we fund miracles. This is not just a slogan. This really happened, and it happened to us.
When RCCS says we fund miracles, that we are the people out there who are helping us fund miracles.
And to you and to all the people who are so good, nobody should need it. I bench people now. You should always be in a position to help. You should never have to ask for help. But you should always be in a position where you can give.